Yeah, welcome back. And remember, we were talking about our friend Jenny, who is a teenager. And eh, this discussion has been very interesting so far. And I said the last time we were going to talk about one of the changes, the first one happening in a teenager that makes them to behave the way they normally behave. And the first one we want to talk about is what we call the hormonal changes, the hormonal shift that is happening in these teenagers. Now, I want us to know that in teenagers, uh, we have boys, we have girls. In a girl normally will reach puberty between say 8 and 13 years. It's a range. So between 8 and 13 years is when a girl will reach puberty normally. But for boys, usually ranges between 9 and 14 years. So that's why you should understand that when you begin to see some changes in the body of your maybe of your daughter around 8, because it's getting earlier these days. Those days, in the days of our parents, uh, a girl would not normally get to puberty until around maybe 13, 12, 13, thereabout. But now it's getting earlier. You see a girl of 9 years, 10 years getting to puberty. So, and then for boys between 9 and 14 years. And this is the period that we talk about, and that is when they are just transitioning into that teen age. When by the time they 12, for example, let's say it happens at 12, then get to 13, you begin to see the changes. That's when what the teenage age now starts. 13, 14, the changes now. So because this is the stage when these hormones are being released. You know, this is the stage when these hormones are being released, and a lot of changes are associated with these hormonal changes. That's when, for example, when a girl reaches puberty at the age of 12 or 10 or 11. So by the time that girl is 13, begin to see those changes in their body, and now they begin to try to adapt and get used to such changes. So, and that's what we're talking about, because these hormonal changes that is happening in these children usually affects their emotions. It affects their impulses. It affects their moods. So, and when you look at this, it sounds like what happens in pregnant women and and the people that are around menopause. For example, in pregnant women, there are a lot of those hormones. There is a surge of it, and bring some other behaviors also in pregnancy. Then during the menopause, some of these hormones they reduce. So I mean, and when you see a woman towards that menopause, of course, begins to notice some changes. They'll come to you and complain to you and say, "Well, I've seen these changes." So it's just hormonal changes at that point in time that they're trying to just a new experience. They are just newly experiencing those hormones that are coming in such. So that is why at this period, because of those hormonal or that hormonal shift, they will have some behaviors that are shifted with that. Number one thing that you can see in teenagers at this age is that they can have mood swings. They can have mood swings. You know, I'm very sure if anyone that has a teenager can agree with it that they have mood swings. I mean, sometimes if are you not happy? So sometimes excited, sometimes I mean, so they can have mood swings at this particular point in time, and of course because of the pubertal changes already happening. I mean, the appearance, some things are happening, the ongoing growth in their bodies, because a lot of them at this stage, the growth of breasts in girls, and the pubic hair, of course, in boys and girls too. You know, I mean, a lot is going on in their body in terms of growth. So sometimes they can be obsessed with such growth over the appearance. For example, a girl wakes up and begin to see that there are changes in the breast, begins to look at it and say, this change is what is it all about? They can get obsessed with the appearance. I remember when we were very young, uh, at that time, I think we were in secondary school, and you already see some of our mates growing a beards. And Those, I mean, already grown babes will tell us, I say, where's your own bed? And they will tell you, say, go and get, in those days, say, methylated spirit, go and rub it off there. And you see, because of the peer pressure of seeing other people having beards, so some of our mates then will apply what we call the methylated spirit, and for the beards to grow. Well, whether it worked or didn't work, I don't know about that. But some of them, I know they were using it. So those are the things we are trying to talk about. They can be obsessed with the growth in their body, and sometimes they can feel awkward about it. I mean, why is this happening in this part of my body? Why is this happening in this part of my body? For the male begins to become ask this deep voice and begins to feel like, what is happening to my body? They can feel awkward about it by their changing body. So those are the things, and very particular because of these changes. This is the time that the parents need to be very close to these children, because they will be seeing these changes, and if we are close to them, they'll be able to tell us some of these changes. Then we'll be able to address and tell them about their body parts. This is how you're supposed to take care of yourself, especially for a girl at that point in time. Menstrual periods will come in. This is how to take care of yourself when you're having during your menstrual period. So these are things that are so essential and associated with hormonal shift, at this particular point in time. Of course, if you see something like extremes of mood swing, that might be out of it. I mean, that might just not be desirable. It's not desirable, but normally at this period, they exhibit mood swings, and these are the changes that are associated with hormonal shift in teenagers. And I want to see you in the next video, because then we'll be talking about the neurological development. And of course, this is Family Clinic, where we talk about how to make better families, and that will help us to get to a better society. Thank you very much. I'll see you next video. Please follow this page, like and comment. If you have other comments that you need to put on there, please let's meet in the comment section. Thank you very much.